Good evening, ladies and gentlemen. My name is Rudolph Williams, and I'm here to talk to you tonight about migraine headaches. Not only am I here tonight to talk to you about migraine headaches, but I'm here to talk to you about a simple solution in getting rid of migraine headaches. The three main points of my speech tonight will include the medical definition of migraine headaches, the loss of natural neck curvature as a reason for migraine headaches, and how to correct this loss of natural neck curvature. It is estimated that about 45 million Americans suffer from chronic headaches. What these people do not know, and what the drug industry don't want you to know, is that there is a simple solution to ridding yourself from migraine headaches. You have to understand that taking medication is only a temporary relief of migraines and misguided, because drugs are never a permanent solution. Now, the question we asked ourselves tonight is, what is a migraine headache? The most common type of vascular headache is the migraine. Migraine headaches are usually characterized by severe pain on one or both sides of the head, an upset stomach, and blurred vision. The pain of a classic migraine headache can be described as intense, throbbing, pounding, and is felt in the forehead, the temple, the ear, the jaw, or around the eye. Classic migraines start on one side but may eventually spread to the other side, and an attack of a migraine headache may last from 1 to 2 pain-racked days. Let me talk to you about the loss of the natural neck curvature as a reason for migraine headaches. If you would take a look at this illustration that I'm about to show you, the spine of your neck should actually be curved rather than straight, as you see in this illustration. When the neck is not curved and when it is straight, the disc in your neck begin to compress, and this will lead to arthritis. In addition, the nerves near the disc become irritated, which will lead to what doctors call neuritis, and the surrounding muscles are abnormally pulled. This loss of the neck curve will ultimately result in headaches and neck pain. Now, I want to give you 5 steps using a particular device and letting you see through illustration how you can get rid of your migraine headache. But before I give you these 5 steps, I want to share with you 3 important factors to consider when attempting to change the ligaments that maintain the curve or the curvature of your neck. Number 1 is duration. The amount of time the ligaments of the neck are held in a stretched position. The longer you hold them in a stretched position, the more curvature of your spine you will have in any given session. Each stretching session should last from 10 to 20 minutes. Number 2 is intensity. The more tension you place on any spinal ligament, including the neck, the better curve correction you will create. Always try to tolerate as much tension as you can. And finally, there's frequency. The more sessions you apply to a stretch of your neck ligaments, the greater curve correction will take place. You should stretch the spinal ligaments at least once or twice a day. Stretching the spinal ligaments several times a day should be encouraged. We suggest that you consider all 3 of these factors with each stretching session. You can vary them with each session that you participate in. Now, I don't want you to confuse this type of neck stretching with the method that doctors use in physical therapy. When they're using tractions, you have to understand tractions are used to stretch the neck, and the procedure that I'm about to talk to you about is used to restore the curvature of the neck. Now, I want you to look at this device for a minute. This device is what we call a CCCD, a cervical curve correction device. It is used to stretch and to strengthen the corrective tissues, the connective tissues in the neck, in the back of the natural curve. Now, the illustration that I showed you, if you can put that device up again, the CCCD device again, it is a lightweight device And I went online, and you can get that device online for about $126. But I'm going to tell you before this discussion ends, or before this speech ends, how that I did a makeshift one for my wife, and you will be surprised what the results were. Now, the Home CCCD, this cervical device, is lightweight and is cost effective, but as before stated, I'm going to show you what I did to make a makeshift one to help my wife rid her migraine headaches. Now, let me show you the steps in using this device. Number one, you want to place the foot bar at the edge of the skirt, as shown in this illustration. Step number two, you want to sit at the bottom edge of the base unit with your knees at a 90-degree angle, as shown in this illustration. Step number three, you want to lie back and position your neck support, or the support beneath your neck. Step number four, you want to bend your neck back as far as possible. Now remember, we talked about tension, and remember we talked about duration and how much tension you could stand. We want you to use as much tension as possible. And finally, step number five, and this is an advanced step, you can grab the bar as illustrated and slowly extend your bent legs to add extra tension to your neck. Now, I know this sounds simple to everybody, but this is a very effective means to get rid of migraine headaches. Now, as a way of testimony, my wife suffered from migraine headaches, and doing research for this particular speech or topic, what I did, I simulated the use of the CCCD device. Actually, I used my arm. I used my arm as a tension bar for my wife. She did a few exercises, and believe it or not, her migraine disappeared. Now, I want to give you a summary of what I shared with you today. 45 million Americans suffer from chronic headaches. The most common type is the migraine, which is characterized by pain in one or both sides of the head and may last up to 2 days. Number two, the loss of the natural neck curve may be a reason, mind you, a reason for migraine headaches. And number three, this loss of neck curvature can be corrected with a simple exercise on a cost-effective device called a CCCD, or a cervical curve correction device. I hope that something I said this evening helped you, and I wish that you would try this procedure and let me know how things turned out. Thank you for your attention.